Arthritis has affected more than 180 million people all over India, and this is more prevalent than those who are affected by AIDS and diabetes. It is a condition which primarily involves joint inflammation, and the affected joints are characterized by swelling, redness, and varying degrees of arthritic pain based on the type of arthritis. There are more than 200 different types of arthritis, but the most prevalent ones are osteoarthritis and rheumatoid arthritis. Osteoarthritis involves degeneration of the cartilage that results in structural and functional failure of the synovial joints. It may be caused due to inherited genetic factors, wearing of the surface cartilage due to old age, or increased amount of stress due to the weight of obese people, all of which lead to injury of bone cells known as chondrocytes. Initially, the affected chondrocytes proliferate and release chemical mediators which potentiate inflammation. They also release enzymes such as proteases, which causes thinning and degradation of the cartilage and forms hollow spaces called subchondral cysts, which accumulate synovial fluid. Proliferation of chondrocytes leads to bony outgrowths termed as osteophytes, and subchondral sclerosis leads to hardening and thickening of the bones. Rheumatoid arthritis, on the other hand, is an autoimmune disease caused by autoantibodies termed as the rheumatoid factor, which are responsible for the inflammation and destruction of the synovium. People with HLA-DRB1 type alleles in their genes are susceptible to abnormal T cell activation. These immune cells fail to recognize self-antigens or host cells. External factors such as cigarette smoking causes modification of self-proteins by a process known as citrullination to form citrullinated peptides. Autoantibodies are formed due to these peptides, and this results in the formation of immune complexes that are deposited in the joints. Within the bone, autoimmune-mediated degradation results in the formation of fissural lesions, as well as thickening of the bone due to sclerosis. Self-destructive apoptotic chondrocytes as well as hypertrophic chondrocytes may also be seen. This results in bone erosion and fusion. As synovial cells, immune cells, and fibrous tissue continue to multiply along with the formation of new blood vessels, a granulation tissue known as pannus is formed. And over time, the pannus bridges the opposing bones to form a fibrous ankylosis, which eventually ossifies into a bony ankylosis, which fuses the two bones. Other types of arthritis include gouty arthritis, in which excessive intake of uric acid-rich foods leads to accumulation of uric acid crystals in the synovial joints of the extremities. Although symptoms depend on the type of arthritis involved, they all usually encompass joint pain, stiffness, redness of the affected joint, and a decreased range of motion. Arthritic pain at night, in particular, tends to increase. Although yet to be proven, studies involving the influence of the circadian rhythm suggest that cortisol production by the body used for subduing pain decreases at night, while melatonin and prolactin increases in production and therefore increases sensitivity to pain. Early onset of arthritis can be treated by a proper diet and an appropriate exercise routine, which may include yoga, moderate walking, or moderate swimming. Smoking and excessive alcohol consumption should be avoided as they contain arthritis-inducing antigens classified as arthritogens. Recovery from early arthritis can be done through following a diet containing fish, nuts and seeds, beans, whole grains, and olive oil. Foods to avoid, however, should include nightshade vegetables such as tomatoes, which contain solanine that has been proven to be associated with arthritic pain. Avoiding uric acid-rich foods in gouty arthritis is essential, such as seafood and organ meats. The medication prescribed by a physician for early arthritis or administered during chronic arthritis include analgesics such as acetaminophen, which only relieves pain and has no effect on inflammation, non-steroidal anti-inflammatory analgesic drugs such as ibuprofen reduce inflammation and also relieve pain, corticosteroids such as prednisolone, which are given orally in early arthritis, are used to suppress inflammation and relieve pain. Disease-modifying anti-rheumatic drugs such as methotrexate are also used for early arthritis. In chronic arthritic conditions, surgical intervention is needed, which may involve Macy techniques, which harvest cells from small pieces of cartilage to grow replacement tissue. Microfractures are performed by surgeons by which small holes are made into the bone, which then leak out bone marrow stem cells from which new cartilage may be formed. Full joint replacement surgeries of the hip and knee are commonly done as a last resort in extensively severe cases of arthritis, at which non-invasive treatment fails to alleviate joint pain or dysfunction. If you would like more information, you may refer to the references listed in the description box below. This has been Rahul from the Medical Buzz. Thank you.